So good day, my name's Alorro. I'm gonna be assessing the peripheral vascular system. So let's start. So good evening, sir. Ako is AR. I'm gonna be your nurse for today. And you're gonna wash your hands, sir, and prepare sa mga necessary equipment, sir. So okay na, sir, mag-assess ko sa mga about sa peripheral vascular system. So sige, sir. Start na sa mga history, present health concern, sir. So, na ba kayo na-notice, sir, na change in color, temperature, or texture changes in your skin?
Wala naman.
Okay, sir. So, do you experience pain or cramping in your legs?
Kuhan. Wala na po.
So, do you experience heaviness and aching sensation in your legs? Aggravated by standing or sitting for long periods? Nagka naman, duway ka maningkod, sir, duway ka mahiga. Masakit pa siya, sir, kung bro. Tingnan ka, mabang na din ka.
Hindi naman.
So, do you have any leg veins that are rope-like?
Wala.
How about any sores or open wounds on your legs?
Wala po.
So, how about mga swellings or edemas in your legs, sir?
Wala po.
How about mga swollen glands, sir, or lymph nodes?
Wala na po.
So, dito ka sa personal health history, sir. So, describe any problems you had in the past with circulation in your arms and legs. Like anong blood clots ba, ulcers, coldness, or numbness, or infection.
Cancel lang po. Healing ito. Hindi ko mag-isa na ako sa mentally. Sa unang duration na heal. Diba ka po na-infected na lang. So, kaya na ko. Straight lang po sa mentally. Diba nag-form naman siya ganun. Nana na ito. So, yung bugabuot siya mata kong first day pa naman ako. Naayaw mag-ganda siya.
So, have you had any heart or blood vessel surgeries or treatments?
Wala.
Do you or does your family have a history of DVT, diabetes, hypertension, coronary heart disease, intermittent claudication, or elevated cholesterol or triglyceride levels?
Kuan, ano sigurong hypertension or kuan, diabetes kay, excuse me, kung lolo kay siya diabetic. And kala pong high cholesterol level kay si mami kay high cholesterol sila.
So, proceed sa mong lifestyle and health practices, sir. So, do you smoke or use any other form of tobacco?
Kuan, before katong work, hindi pa parang dito. But every after work, sa school,
So, pagpilang ko, sir.
kuan, hindi mo pa siya sa katagkan 4 to 5 sticks.
So, if you use tobacco currently, so, are you willing to quit, sir?
Gusto nyo ko actually yung stop or kita ko way or hinihina yung kita siya.
So, take-exercise ko kasi. Are you experiencing any stress in your life at this time?
So far, ganila mong gano'n sa studies in terms of situation. Ito nang okay na siya.
How have problems with your circulation affected your daily functions?
Kuhan, wala raman.
Do leg ulcers or varicose veins affect how you feel about yourself?
Kuhan siguro kung nako'y parang varicose veins. Usual, normal gano'n siya kasi mga lalaki. Hindi talaga sa kamot kung tutulog sa tingin. Maybe sa girls, siguro sa kami sa gulang may nakakil sa tuwa ko.
So, do you regularly take medications prescribed by your physician to improve your circulation?
Wala naman may medication.
How about the wearable support hose to treat varicose veins, sir?
Wala.
So, mga siya, sir. So now it's time for the physical examination of the peripheral vascular system. So the first thing you would do is gather equipments, centimeter tape, stethoscope, Doppler ultrasound device, conductivity gel, tourniquet, gauze or tissue, waterproof pen, BP cuff. So don't forget to demonstrate courtesy and explain procedure to the client. Then do hand hygiene. and ask the client to put on a gown to provide privacy. So now let's start with the arms. Inspection. Inspect bilaterally for size, presence of edema, and venous patterning. Inspect bilaterally for skin color and lesions. Inspect fingertips for clubbing. Palpation. Palpate fingers, hands, and arms for temperature using dorsal surface of your fingers. Palpate capillary refill type. Palpate the radial, ulnar, and brachial pulses. Palpate epiclear lymph nodes behind the elbow in the groove between the biceps and the triceps muscles. Perform Allen's test. A. Have the client rest the hand palm side up on the examining table and then make a fist. Use your thumbs to occlude the radial and ulnar arteries. Continue pressure to keep both arteries excluded and have the client release the fist. Note that the palm remains pale. Release the pressure on the ulnar artery and rewatch for color to return to hand. To assess the radial patency, repeat the procedure as before, but at the last step, release procedure on the radial artery. Let's go with the legs. Inspection, palpation, and auscultation. Inspect bilaterally for skin color from the toes to the groin. Inspect bilaterally for distribution of hair and condition of nails. Inspect for lesions or ulcers. Note whether margins are smooth and even, locations such as pressure points, size, depth, and color. Odor. Inspect for edema. Unilateral or bilateral. If client has edema, determine if it is spitting or non-spitting. If client has spitting edema, rate on 1 plus to 4 plus scale. Palpate legs for skin temperature if it cool, hot, or warm. Use dorsal surface of the hand. Palpate the superficial inguinal lymph nodes while keeping the genitals draped. If detected, note size, mobility, or tenderness. Horizontal lymph nodes palpate in the groin. Vertical lymph nodes palpate along the inner aspect of the thigh. Now palpate the auscultate femoral pulses over artery. Listen for bruits. Palpate femoral, popliteal, dorsalis pedis, and posterior tibial pulses. Femoral pulses, place patient in the supine position and feel below the inguinal area, halfway between the symphysis, pubis, and anterior and posterior iliac spine. Popliteal pulse. Have client bend knees or, if on the table, roll onto the stomach and flex leg 90 degrees. Press deeply to feel. Then with the dorsalis pedis pulse, have client dorsiflex or extend foot. Place fingers between patient's great toe and the first toe and slowly move away from the toes between the extensor tendons. Posterior and lastly posterior tibial pulse, located on the medial malleolus of ankle and tendon of Achilles. Inspect for varicosities and thrombophlebitis by asking client to stand. Deep phlebitis by quickly squeezing calf muscle against tibia. Homan's sign by extending leg and dorsiflex foot. Positive if with calf pain. Perform positive change test for arterial insufficiency while client is in supine position by placing hands both on the client's ankles. Raise legs 30.48 cm or 12 inches above heart level and ask client to pump feet up and down for 1 minute. Have client sit up and dangle legs. Note color of feet, time for interval for color to return. If varicosities are present, perform manual compression test by having client stand. Firmly compress the lower portion of the varicose vein with one hand. Place other hand 15.2 to 20.3 cm or 6 to 8 inches above hand. Feel the pulsation on upper hand. If varicosities are present, perform the Trendelenburg test. With client in supine position, elevate legs at 90 degrees for 15 seconds. With legs elevated, apply tourniquet to the upper thigh. Assist client to a standing position and serve for venous filling. Remove the tourniquet for 30 seconds and watch for sudden filling of the varicose veins from the bone. So that's all for finding the objective data for peripheral and vascular system. Thank you.